Mouth ulcers or oral ulcers, the most uncomfortable and painful condition, makes it difficult to eat, brush and talk properly. Hi, I'm DR.SALONI, an oral physician and maxillofacial radiologist. Today I'm going to talk about the most common condition which we all usually encounter in a day-to-day life, oral ulcers, or you can say mouth ulcers. So in this video, I'm going to talk about why do we get these ulcers? What are the home remedies of these ulcers? Are they cancerous? Why do they reoccur? And how long do they take to heal? So if you like my content, do subscribe to my channel Decode Dentistry with DR.SALONI. I write content, make videos on oral health and doing in-depth research on these topics for you all. Mouth ulcers are very common. Your parents, your grandparents, your siblings, you yourself, anybody can get them. And at that time, we all end up Googling its treatment and try our own remedies at home. So I always say that if you understand a topic, do share with your loved ones. With this way we are creating a change for the oral health awareness. With the right knowledge, we can eradicate the ulcers quickly and prevent them from flaring up. So mouth ulcers are basically painful sores which occurs on the inner lip, tongue, your gums, roof of the mouth or throat area. And it occurs accidentally due to any trauma or injury. For example, if you accidentally bites on your cheek or your tongue, you get an ulcer. Sipping a hot coffee, burning sensation while eating a hot slice of pizza, injury during toothbrushing, and continuous rubbing against the sharp or broken tooth, irritation while using any toothpaste or mouthwash, and sharp edges of dentures, and injury from the broken tooth or any sharp tooth. All of these will pop up an ulcer in your mouth. But sometimes ulcers may happen without any trauma or injury. You wake up in the morning and suddenly feel a burning sensation at a certain point of mouth, which converts into a red spot and ultimately into a painful ulcer. So this form of ulcer is called as aphthous ulcers or canker sores. These sores have a tendency to reoccur almost sometimes 3 to 4 times a year. But why does it occurs? Aphthous ulcer occurs due to an attack in your mouth from your own immune system. The most common cause or condition is stress or anxiety, which you usually encounter in your school days or your college days. Number 2, hormonal changes in women menstruating or during pregnancy. Number 3, excessive citrus fruits or spicy foods leads to formation of these canker sores in your mouth. Next is genetic factors. If your parents got aphthous ulcers, you have 90% chance of getting them. Tobacco use or recently suddenly quit of tobacco use. If any person quit tobacco suddenly, then he or she has a chance of getting canker sores very easily. Next is food hypersensitivity. The foods like excessive chocolate, peanuts, almonds, or a compound called SLS, which means sodium lauryl sulfate. It is a compound which is usually found in a toothpaste, cause allergy in our mouth and leads to the formation of canker sores. Next is nutritional deficiencies or vitamin B12 deficiencies. So all of these reasons will lead to the formation of aphthous ulcers or canker sores in your mouth. These ulcers are not contagious and you won't get them by sharing or by kissing. Now, how will we treat these ulcers? What are the remedies which we do to eradicate these ulcers very fast or quickly? Mouth ulcers that occurs due to trauma or aphthous ulcers usually harmless and heals within a week or takes 10 to 14 days to heal. But if these ulcers are extremely painful, then try some home remedies. Number 1. Avoid sour and spicy foods for a while until your ulcers heal. Number 2. Drink plenty of water and stay hydrated. Number 3. Rinse your mouth with warm salted water 2 to 3 times a day. Number 4. Try licorice, also called as mulethi in Hindi. Add powder in warm water and swish it in your mouth and then spit it out. Do this once in the morning or evening for 2 to 3 weeks. Number 5. Drink chamomile tea 3 to 4 cups a day. Number 6. Add or apply honey on your ulcers. Number 7. Apply coconut oil on your ulcers. You can also do oil pulling as well. Number 8. Aloe vera juice. Take 1 to 3 tablespoons of aloe vera juice, swish it in your mouth and drink it. Try this for 2 to 3 weeks. Number 9. Take vitamin B complex. Number 10. Use herbal toothpaste instead of toothpaste containing SLS or sodium lauryl sulfate. You can also take over-the-counter medications which is available at your local pharmacy. The best thing or the best option to buy is the gel or cream containing benzocaine. For example, you can buy Orasor gel, Mucopain gel, etc. You can also buy milk of magnesia, or if the ulcers are very painful, then you can take ibuprofen as well. Chlorhexidine mouthwash, which is alcohol free. Chlorhexidine is basically an antiseptic which helps to heal your ulcers, but it causes brown stains to your teeth as well. So use it only for 2 weeks. Following all these remedies, if ulcers won't heal within 3 to 4 weeks, then you have to visit your dentist. Your dentist might prescribe you blood test to investigate any nutritional deficiency or systemic conditions and perform biopsy at a later stages. Also, your dentist may prescribe medications, the best being dexamucobase. He can also perform laser therapy in order to reduce the pain and discomfort which stimulate healing of your ulcers. Are these mouth ulcers cancerous? Look, the most common condition for mouth cancer is mouth ulcers that do not go away for several months, or mouth ulcers which do not heal for several months. So, there is a persistent lump in the mouth and the neck region which usually do not go away for months and years. You can also see a mix of red and white patch which may be rough, hard and not easy to scrape off. Mouth cancer is also associated with excessive alcohol use and tobacco usage. If you have any questions regarding mouth ulcers, feel free to comment below. And don't forget to subscribe to my channel. Thank you.